and foot. Okay, so for the leg, we already know the bones and everything. So this is for your revision. In the leg, the muscular compartment is divided into three compartments. Okay, as already we have seen, we have anterior, posterior, but instead of medial, we have lateral compartment in the leg. So this lateral compartment has the muscles. They are called as peroneal muscles. Okay, if you remember, I already told you whatever peroneal will come, it is related with the lateral side. It is related with the fibula. In some of the book, you will see that they call
Doctor, we can't hear your voice.
the common fibular nerve.
Doctor, your sound cut for me.
Can you hear me?
Yes, now it's okay.
Okay.
Can you repeat just the last?
Yeah.
Now the sharing is gone.
Okay, so I was talking about the lateral compartment. So lateral compartment, in the lateral compartment, we have the group that is called as peroneal. Peroneal, or you may call it fibular. In some books, they mention it as the fibularis. What is the nerve for lateral compartment? So it is superficial peroneal nerve. If you remember, the common peroneal nerve will divide into superficial and deep group or deep nerve. So what is the nerve for lateral compartment? It is superficial peroneal nerve. Okay, what is the artery? Branches from the peroneal artery. In the anterior compartment group muscles are known as extensor muscles. The nerve is known as deep peroneal nerve, and the artery is anterior tibial artery. Posterior compartment, so we know the posterior compartment is responsible for flexion, so it is called as flexure group. Okay, and here what is the nerve? Tibial nerve. If you remember, you have seen in the model that sciatic nerve is coming from the back side. It will divide into common peroneal and tibial. Tibial is going to supply the posterior group of muscles. They are called as hamstring. Then this same tibial nerve will go down to supply the posterior compartment of leg also. So we will see the muscles. We have two muscles, peroneus longus and peroneus brevis. Okay, so you can see the peroneus longus. Why it is called as long? It is coming from the upper part. So here again you can see this will come from the upper lateral surface of the fibula. What is the insertion? It will go, and you can see this is a long muscle from the lateral side. It is going, it is crossing, and it is coming to the first. What is this? This is coming to the first metatarsal bone. Okay, from lateral side, it is going to the first metatarsal, which is the medial most metatarsal bone. Okay, that's why it is called as longus. What is the nerve? It is called as superficial peroneal nerve. What is the action? It is called as plantar flexion and eversion of foot. Okay, so in the practical session, you will try to do this action, how you can do the plantar flexion, how you can do the eversion of the foot. Then we have the peroneus brevis. So if you cut the longus, you can see there is a brevis muscle which will come from the lower part of the fibula. Okay, so as this is a short muscle, so it will be inserted nearby. Okay, so where? At the base of the fifth metatarsal bone. Nerve supply is also same, its action is also same. So these two muscles you can see in the lateral compartment. Now we have something about the superficial peroneal nerve. So it will arise from where? From the common peroneal nerve on the lateral surface of the neck of the fibula. Okay, so you always have to remember the relation of any nerve with the bone, because if you remember in practical session I showed you that this head of the fibula is very superficial, it is subcutaneous, you can feel. Okay, so this nerve will be around this neck of the fibula. So you can imagine if there is any fracture at the neck of the fibula, what will happen? It will cause injury to the common peroneal nerve. Okay, so it will go into the lateral compartment. So what branches it can give? It will give branches to the peroneus longus and brevis. Okay, then it will give cutaneous branches. Cutaneous means for the skin. So obviously it is going to supply the lateral side of the leg, intermediate area of the dorsum, okay, this one, except the first interdigital cleft. Okay, the first interdigital cleft means the space between the your thumb, okay, great toe and the second toe. This interdigital cleft is not supplied, otherwise all this area it is supplied by the cutaneous branch of the superficial peroneal nerve. Then we have the muscles of the anterior compartment. So here we have important 4 muscles. Okay, so we know this is extensor compartment. So obviously there will be extensors. Which extensors? The one extensor which is for the great toe. This is called as extensor hallucis. Okay, then we have the extensors, okay, which will be acting on other lateral toes. If you remember in upper limb also you saw the digitorum longus. Do you remember? Same way here also we have digitorum. Digitorum means this is for the lateral 4 digits. Then on the anterior side we have tibialis anterior. Then we have one more peroneus. Okay, the peroneus tertius. So if you remember, the peroneus longus and brevis included in the lateral compartment, but the peroneus tertius, it is in the anterior compartment. So these are the 4 muscles. Okay, if you see the sequence, the first one will be tibialis anterior, the second one will be external hallucis longus, the third one will be digitorum, and the fourth or the last one which is here, okay, at the small or at the little toe, it is the peroneus tertius. What is the nerve supply? The peroneal nerve. Okay, and what is the artery? That is the anterior tibial artery. So its origin is in easy. It will come obviously from the tibia bone, okay, upper half of the tibia, then from the interosseous membrane. Where is the insertion? So you can see this muscle, it is inserted over the base of the first metatarsal bone. Okay, if you can correlate from the another muscle, that is the peroneus longus, this was also coming at the base of the first metatarsal from the your plantar aspect. Then you have the peroneal nerve. Which action will be done by these muscles? So this is called as dorsiflexion or extension. Okay, so just try to do, if you do the extension of this. Okay, so here we don't call it extension or flexion. Here we call it dorsiflexion or plantar flexion. Okay, then it has additional action that is called as inversion. Inversion of the foot. Okay, and it will support the medial longitudinal arch of the foot. If you remember, we saw the arches, so this is one of the main support for the medial longitudinal arch. We have another extensor hallucis. So from where it will come? So you can see it is coming from the fibula and interosseous membrane. So because hallucis is specific for the great toe, so obviously it is going to act on the where? It will act on the great toe. Okay, so it will do the dorsiflexion of the foot At the ankle joint, where is the ankle joint? Here. Okay, and it will do dorsiflexion of all joints of the big toe. This, okay, this distal interphalangeal joint, proximal interphalangeal joint, and all this dorsiflexion will be done by this muscle. Then we have extensor digitorum longus. So obviously this will also be inserted where? Okay, this will also be inserted over the your lateral four toes. Okay, so here we can see the origin that it is coming from the fibula. Okay, anterior surface of the fibula. Then it has been divided into four tendons. Okay, these are the four tendons, and these four tendons are inserted on the middle and distal phalanges of lateral four toes. Nerve supply, so it is similar like the peroneal nerve. Okay, what is the action? So obviously it is also going to do dorsiflexion of the foot at ankle joint, plus all the small joints here you can see, they all will be dorsiflexed by the extensor digitorum longus. Okay, so if you compare the upper limb with the lower limb, so upper limb was more complicated, having more nerve, having brachial plexus, but here it is somewhat easy, because if you remember any compartment, it has similar, all muscles will have similar nerve supply except some few exceptions. Okay, so if you remember the anterior compartment, okay, you can say the anterior compartment will have all the four.
Doctor, your voice has been cut off.
Doctor, we can't hear your voice.
Yes, Assalamu alaikum. I'm sorry, I was out. I did not understand. Just 1 minute.
Doctor, your voice is lagging.
Yes, yes. Just I'm trying to share the content. Just a moment, because my screen also went off. Okay. Can you see the screen now?
Yes, we do.
Okay. I'm sorry. I don't know. The computer shut down automatically. So we were talking about the muscles. So anteriorly, you have the four muscles, and the four muscles have the similar nerve supply, the deep peroneal nerve. Okay, but the action you will find there is something different. Okay, so when you will see the tibialis anterior, extensor hallucis, and the extensor digitorum, they all have what action? Dorsiflexion. Okay, but here you have the dorsiflexion, peroneus tertius, the fourth muscle. Okay, but here you have extra dorsiflexion plus eversion. Okay, so you can compare here the action of the tibialis anterior. It is dorsiflexion with inversion. But when you see the peroneus tertius, you have dorsiflexion but with the eversion. Okay, so there are some action which you have to memorize. Okay, and in the practical sessions you can just try to see its muscles origin, action, and its nerve supply. What is the artery? It is the anterior tibial artery. From where it will come? If you remember, there is a popliteal artery. Okay, the popliteal artery was coming from where? Any idea? The popliteal artery, it is a branch from where? Any idea from which artery?
Femoral.
Very good. It is a continuation of the femoral artery. Very good. So it will descend in front of interosseous membrane. So then after that what will happen? It will end in front of the ankle joint. Okay, between the two malleoli. Okay, here if you might have seen in the hospital, if you will get the chance in emergency ward or in emergency department, you will find if you have some patient, you will see the radial pulse, and after that you will feel here something. What you will feel for the dorsalis pedis artery. Okay, this is the dorsalis pedis artery, which can be felt between the medial and lateral malleoli. Then we have the deep peroneal nerve. So again, we know this is a branch from the common peroneal nerve. Okay. So what branches it will give? It will give muscular branches to the anterior compartment of the leg. Okay. And one muscle of the, you will see this extensor digitorum brevis. This is the muscle of the foot. Okay, articular branches to the ankle joint and cutaneous branch to first interdigital cleft. Okay, if you remember in superficial peroneal nerve, we saw that this is going to supply the dorsum except the first interdigital cleft. So this first interdigital cleft is supplied by your deep peroneal nerve. Now you can imagine if something will happen here, okay, at the neck of the fibula, right? Generally, maybe if there is any direct trauma or there is any fracture. So this condition, it is called as foot drop. Okay. This condition is called as foot drop because this extensor will not act. Okay. So it will not, your foot will not go up like normal foot. So this, if you remember, there was a wrist drop in upper limb. So like same, you have the foot drop in the lower limb, which is caused by injury to the common peroneal nerve. Then what are the muscles of the posterior compartment? So in the posterior compartment, we have some more muscles, okay? Some superficial and some deep. So superficial group, you have the gastrocnemius, soleus, and plantaris. Okay. In the deep group, you have popliteus, flexure, hallucis longus, and flexure digitorum longus, and tibialis posterior. Okay, all these muscles will be supplied by what? By tibial nerve. So gastrocnemius, okay, this is the muscle which is called as calf muscles. Okay, so the thickness of the calf is by this gastrocnemius muscle, which has two heads of the origin, lateral head from the lateral condyle, medial head from the medial condyle. What will happen? This also will make a common tendon. It is the thickest tendon in the body, okay, which is known as tendocalcaneus, okay, or Achilles tendon, and it will be finally inserted over the posterior surface of the calcaneus bone. What action will be performed by this? Flexion of knee and plantar flexion of ankle. Okay, because it is crossing both the joints, so it will have action on both the muscles, both the joints. The another muscle, it is called as plantaris. Okay, it is very small muscle. It may be present or may not be present. It takes origin from lateral supracondylar line. Okay, and finally it will also be inserted to the posterior aspect of the calcaneum, that is called as tendoachilles. Then we have another muscle that is also called as soleus. Okay, if you can see, if you remove the gastrocnemius, then only you can see this muscle. Okay, so if you remember, we saw on the posterior surface of the tibia there was a soleal line. Okay, it will take origin from the soleal line, the head of the fibula. Its insertion is over the posterior aspect of the calcaneum, same along with the gastrocnemius and plantaris. So you can say that these three muscles will form a sort of thick tendon that is called as tendocalcaneus. Okay, the action, it will do plantar flexion at the ankle joint. Okay, you can see this muscle. This is somewhat flat. Okay, so sometimes when you have, maybe when you feel so much of tired, if we stand for a long time, okay, if you compress this soleus, this muscle, this calf muscles, you will have sort of relaxation. Okay, because the venous blood will accumulate here, because we have the venous plexus inside this muscle. Okay, so this is called as soleus venous plexus. This acts as the peripheral heart. So here you can see the tendoachilles. Okay, this is said to be strongest tendon in the body. This gastrocnemius, soleus, and plantaris. Then in the deep group, you have a very short muscle that is called as plantaris. Okay, this is called as popliteus. If you remember, there is a soleal line. So above the soleal line, this muscle will be present. Okay, over the posterior surface of the tibia, above the soleal line. Okay, and its origin is from the lateral femoral condyle. What will be the action? It is responsible for the flexion and rotation of the leg medially. Its main action is in the knee joint for unlocking of the knee joint. Okay, when you will stand, okay, unlocking means, so inshallah when you will see the knee joint, we will try to explain this function. Okay, so just for now, just remember that unlocking of the knee is done by the popliteus muscle. Okay, now we have the popliteal fossa. So you can see it is a diamond shape. Okay, it is not triangular, it is diamond shape. Okay, so in the upper boundaries, you have the superolateral, you have biceps femoris. Superomedial, you have the semitendinosus and semimembranosus. Okay, and inferolateral and inferomedial, you have both the heads of the gastrocnemius, medial and lateral. Okay, its roof will be formed by the fascia of the thigh, that is called as fascia lata. Okay, then what are the contents present here? So very important, we have popliteal artery, we have popliteal vein, Then we have the small saphenous vein. If you remember the small saphenous vein which will come from the dorsum of the foot. Then we have here the division of the sciatic nerve. What are the two divisions you can see? The tibial and common peroneal. Then we have the popliteal lymph nodes. Okay, and then just remember that the popliteus muscle. Where is the popliteus muscle? Then you will ask. So popliteus muscle will here form the, okay, here the popliteal muscle will form the floor. Okay, over the floor you have the, if you remember the popliteal surface of the femur, I told you on the posterior aspect of the femur we have the area which is between the two condylar lines, that is called as popliteal surface. Then we have the tibialis posterior muscle. So like anterior, we have tibialis posterior, which takes origin from the posterior surface of the tibia. Okay, and what will be the insertion? So you can see here that this is dividing into so many small tendons. Okay, and it will be, these tendons will go to all the tarsal bones except the talus. Okay, except the talus. And so here you can see, okay, the talus is not, you cannot see because it is little above. So here you can see these strips are going to all the tarsal bones except talus. Okay, and base of the middle three metatarsal bones. The nerve supply, tibial nerve. What is the action? So just remember all these muscles you will find, they will do the plantar flexion. Okay, and tibialis posterior will do the inversion of the foot. So this also will do the plantar flexion of the foot. So what is this muscle? Flexure digitorum longus. Okay, same. Now we know easily that its origin from the tibia, its insertion, it will again divide into four slips and it will go to the lateral four toes. The flexor hallucis, so it is also obvious that it is going to be inserted over where? Or to the great toe, distal phalanx of the great toe. So here you can see it is coming from the posterior part of the fibula. Okay, and it is crossing all the small joints here and finally inserted over the distal phalanx. Okay, the action again, it is going to do plantar flexion. What is the nerve? The tibial nerve. So now we have this tibial now. So this we know it will descend through the popliteal fossa to the back of the leg. It is going to supply all muscles of the posterior compartment of the leg. Okay, and it will give branches to knee and ankle. Now one of the important nerve which is known as sural nerve. Okay, it is the cutaneous branch. Okay, which is going to supply the most of the part of the leg and foot. Then we have another cutaneous, median calcaneal. This is also the cutaneous nerve. And finally, what will happen? This tibial nerve at the plantar side, it will divide into medial and lateral plantar nerves. Now, what will happen if there is damage to the tibial nerve? So you can see here this area in the posterior, which is not very common, but if it will happen, what will happen? There will be loss of plantar flexion of the foot. Okay, this will be just opposite to the foot drop. So patient will have difficulty in getting the heel of the ground. Okay, so he will not be able to take his heel off the ground and he will walk with the some sound, some noise over the ground. That is called as shuffling gait. Now, muscles arrangement, if you see, you cannot find all the muscles its origin because we don't have models in which you can see all the muscles separately. Okay, but here at this level, at the extensor retinaculum level, you can find some tendons. Okay, if you remember its arrangement, you can easily identify them. Okay, so you have the first tendon, which is called as tibialis anterior. After that, you have the next tendon that is called as extensor hallucis longus. Okay. After that, you have the anterior tibial nerves and vessels. Okay. And this nerve is also called as deep peroneal nerve. Then again, you have the digitorum, and then you have peroneus tertius. So if you remember this sequence, you can identify. Okay. So this you can memorize by this mnemonic. Tom has very nice dogs and pigs. Okay, so just remember this, memorize this, and tomorrow you can try to see this. Then we have the another retinaculum that is called as flexion retinaculum. So here also you can try to find the muscles, attachment of the tendon, and its specific arrangement. Okay, so what are the muscles or what are the tendons arranged from medial to lateral? Okay, so these are the tendons. You can see only the tendons at this level. Okay, so first, if you will start from medial to lateral side, first you have tibialis posterior, then you have flexor digitorum longus, this one, then you have the posterior tibial vessels and tibial nerve, then you have flexor hallucis longus. Okay, just try to remember this and try to see this. It is present in our models. Now we have the foot. So if in the foot, if you cut the skin first, you will have some fascia, which is very, very thick. Okay, this is called as plantar aponeurosis. Okay, posteriorly it will be attached to the calcaneum. You can see here, and anteriorly it will divide into 4-5 slips, and it will go to the each toe. What is the function? Because we know we have neurovascular bundle with each muscles. So it will protect the each underlying structure. Okay, because it is very thick. So it will make a sort of barrier, okay, which will not allow the nerves and vessels to get compressed. Okay, and it will also maintain the longitudinal arch of the foot. Then muscles here in the sole, you will find that they are arranged in 4 layers. Okay, so we cannot see all the layers, but just we can memorize its name and nerve supply. Easy, no need to go in much detail. So we have the first layer in which we have 2 abductors and 1 flexor in between. Okay, so you can see this is a flexor, which is called as flexor digitorum brevis. Flexor digitorum brevis. Okay, you know brevis means short muscle. So you can see it is coming from here, it is inserted over here. Then on each side, we have abductor hallucis for the great toe and abductor digiti minimi for the little toe. Then we have the second layer. So in the second layer, you can find that we have the 2 long tendons and 2 muscles. Okay, so which 2 muscles you can see here? You can see this is the quadratus plantae. Okay, and here we have the this 4 muscles. What are these? This you already know. In the upper limb also, there were the muscles, very small muscles which are attached to the tendon. They are called as lumbricals. Okay, then we have the tendons. Which tendons are coming here? So here you can see this one. This is the flexor hallucis longus, and here you can see flexor digitorum longus. It's like this. What are the structures in second layer? 2 tendons, 2 muscles. What about the third layer? So in the third layer, you have 2 flexors, okay, on each side. One flexor is for the hallucis, flexor hallucis brevis. One is for the little finger, flexor digiti minimi brevis. Okay, and in between here we have the adductor. Okay, it is adductor. What about the fourth layer? Again, fourth layer is like second layer. In second layer also, if you remember, there were 2 tendons, 2 muscles. Okay, in the fourth layer also we have 2 tendons and 2 muscles. Okay, so which are the two tendons very deep? Peroneus longus and tibialis posterior. Which are the muscles? Okay, if you remember the interossei, which are present between the bones. So we have the plantar interossei and we have the dorsal interossei. Okay, the plantar interossei will do adduction, dorsal will do abduction. This we know from the upper limb itself. What about their nerve supply? So all the muscles are supplied by lateral plantar nerve. Okay, in which only 4 muscles which will be supplied by medial plantar nerve. So medial plantar nerve, so medially which muscles will be there? Okay, the muscles means the related with the great toe, like abductor hallucis, like flexor hallucis brevis, okay, flexor digitorum brevis, and first lumbrical. All the muscles which are present towards the medial side, they will be supplied by medial plantar nerve. Okay, so we finish here. Inshallah, in practical session, we will try to see this. Okay. So just for my advice that you don't feel that it is too much, just remember or memorize the muscles name, its group, its nerve supply and action. Okay, for the attachment of the leg and foot, just I will not advise you to go because I know this is going to be very difficult, but the group, its name, its nerve supply, its action and its injury. Okay, and whatever is possible to see, you should see and try to identify. Okay, so shall I finish here or anyone wants to ask anything? So I think there's
Thank you,
no
Doctor.
question.
Thank you, Doctor.
Okay. Okay, thank you so much. Have a nice day.